Erectile dysfunction. We're going to be talking about erectile dysfunction, what erectile dysfunction means and the causes, and then how to go about this. Now, erectile dysfunction means when a man cannot maintain an erection. This can be frustrating, but however, there is cure. Most men, they want to, be hard, but then it falls down, even leading to, as they are putting in, it's coming down. This is what this video is going to be basically telling you why this happens, and so that you will find way to fix it. Okay, now somebody that has erectile dysfunction may find it difficult to impregnate a lady, because has to stand before you impregnate a lady, but it is still possible if you are able to stand a little before getting the sperm somewhere there. One of the causes of this erectile dysfunction is not being able to maintain an erection is, number one, some sexually transmitted infection can cause this. For instance, gonorrhea, chlamydia, syphilis, HIV, some sexually transmitted infection can cause this. Some other chronic infections like diabetes, some chronic medical condition like diabetes can cause this. High blood pressure medications can cause this. Okay, so this is why most women should actually take it easy with their husband and let your doctor know if you're facing anything like this. There's a way to treat it. Some drugs will be prescribed for you. Okay, now the next thing that can cause erectile dysfunction is obesity. Yes, if you're so big, it can cause more than the body has two hormones, estrogen and testosterone. A man has more of testosterone. Okay, so because you become so big, more than your BMI becomes so big, you will see that you start having more estrogen than testosterone, which estrogen is the female hormone. Okay, so and your testosterone level will start reducing, and you find it that you will be finding it hard to maintain an erection. But the next thing that can cause this is smoking. Yes, whenever you smoke, I know most men may say this is a lie, but it's just a matter of time. You're not experiencing it now, you will experience it. Whatever kind of smoke, as you're smoking, the blood supply to your organs, not just your penis, is reduced. Your arteries are reducing. Your blood vessels are reducing in size gradually. Before you know it, blood supply is hard. It won't be as fast as possible. There will be pressure, even leading to high blood pressure. And then for the blood to supply other places, and before getting down there, it's hard. You will, because that is what erection is. To maintain an erection, blood has to be supplied so much there so that it will be engorged. So as you're smoking, gradually, the walls of your blood vessels are thinning. Before you know it, high blood pressure. Before you know it, you may not even be able to stand erect. Smoking doesn't give you what you are thinking. It's just the euphoric state where you feel after smoking weed, you are hard. No. When you get older, as time goes on, you will see that it will start falling. Be aware of this. Now, the next thing that can cause erectile dysfunction is age. Yes, as you're aging, testosterone level is reducing, and your sperm quality and everything is also reducing. So as you're aging, this is also reducing. The remedy of this is to take some supplements, work out. I have videos on how to supplement for a man having low sperm count and all. That video will help you a lot. The next thing that can cause this is what we call benign prostate hyperplasia. Okay, prostate cancer. They can cause this. When the prostate, where the whole thing, where the sperm and seminal fluid, where they all go in, the place is inflamed, or there is a lot of thing going on, or it's not working, or there's cancer there. It can affect your it can cause erectile dysfunction. Yeah, because basically that place is where all the process, all the fluid that makes up the semen, the sperm comes out from. Okay, so if there is BPH, benign prostate hyperplasia, maintaining erection will be hard. Maintaining an orgasm or ejaculation will be painful. Okay, so this is also a cause of. The next thing that can cause this, very important, is anxiety and psychological performance kind of. So most people, anxiety, because they are, in aiming that, hoping that, oh, this thing will come and embarrass me again. They are agitated. So this can even lead to this. Okay, so they are scared even before starting or initiating the process. So anxiety can impair your performance level. Okay, now the next thing that can cause this also is high blood pressure, like I mentioned before, diabetes, high cholesterol level. This has an impact on your testosterone level. Please make sure you manage them well. Even the medications, there's another one here is also some medication, side effects of some medication can cause this. Okay, so some medications like antihypertensive drugs, anti-diabetic drugs, antidepressant drugs, these drugs also can cause erectile dysfunction. Let your doctor know about this. Okay, now having talked about this, let's talk about cure. It depends. I know the next thing you are expecting me to say is Viagra. No, Viagra shouldn't be taken. If I look at that video on Viagra, you will understand that you shouldn't take Viagra over the counter. You shouldn't go to the pharmacy and get Viagra without doctor's prescription, especially if you're on antihypertensive drug. It can kill you. Please watch that video. It can kill you. On the men's playlist, it can kill. The blood pressure will drop so much that the person can die. This is why people are dying on top of a woman. So you have, first of all, first thing you need to do is, if you're experiencing this thing, start working out. If you're sedentary lifestyle, stop it. Start becoming active. Work on your weight. Start eating nutritious food. Reduce to the barest minimum foods that are high in cholesterol, foods that are high in starchy foods, over-the-counter foods, processed meat. Reduce it to the barest minimum as you can. Okay, start eating clean vegetables. Take teas, green tea, very beautiful, green tea and lemon, very beautiful. Garlic, ginger tea, fresh, of course, very beautiful. Start working on your weight psychologically, mentally, gradually. First of all, you will now have to check if you have any underlying condition. For instance, if you have benign prostate issues, of course your doctor will have to give you some medications and check what is going on. Make sure you check your prostate gland every time. Okay, every time, please make sure you check. It doesn't take time. Your doctor will just check it. It's a very simple procedure to check. So the next one is you make sure your drugs, if it is your drugs that is affecting you, you let your doctor know. Your doctor will have to adjust some doses or change the drugs or prescribe another drug for erectile dysfunction. For instance, substitute of Viagra or Viagra in lower doses, depending on the drugs that you are in. There are some drugs that you are in that you are not supposed to take Viagra. Please be aware of this. Okay, so having known about this, of course, you and your partner will have to work things out and take some supplements based on doctor's prescription. I have some of them, supplement that men should take if you're having low sperm count and all. So please let me know if you have questions, and workout, exercise will even help you bring it back as fast as possible. Trust me, exercise will help. It will help you last long. It will bring up your testosterone level. Becoming the masculine man in nature will start coming up gradually. So like this video. My name is Nurse Mary's. I'm a nephrology nurse. Make sure you like, share and follow for more.